Stress fracture of the second metatarsal at the metaphyseal junction. As we can clearly see, the bone production, which is called secondary bone callus formation. Clearly, as we can see, if I put my finger on it, and it continues on top. And so therefore, if you compare the marrow of the bones, and then there's a little bit of superimposition in comparison to its neighbor. So that's one of the suspicions. Clearly also the cortical changes in comparison. So as we look at it from this angle, and then we're going to look at it from a different angle. And if we compare it to the other contralateral limb, the marrow is much, much cleaner looking on the second metatarsal. And furthermore, much, much cleaner on the slight lateral oblique. The concerns were initially, since there was no true injury to the foot, is maybe hyperuricemia such as gout, which is very common in today's society. It does not have to be localized to the big toe, it could be anywhere. And versus other pathologies such as stress fracture formation, which came as such upon doing the x-rays. So the person claims that this has been ongoing for about 8 weeks. However, no true injury. Claims wearing a boot without the inserts, and the pain starts to be accelerates, especially with hyperextension and standing on the toes. That is more pronounced along this area and continues to the web space. So why would that be? So if we go back to this section, as we can see the buildup of bone, this area, there's a small little nerve, which is a deep peroneal nerve, is in the area. As we clearly can see, there is buildup of soft tissue, intensity or density, and that is indicative of inflammation, more likely entrapping the nerve, the deep peroneal, and her symptoms not only along the bone is causing pain, but in between the web space, the first web space between the big toe and the second toe, which is common because of the deep peroneal nerve entrapment or compression. So as we can see, the overproduction of tissue, of bone callus formation, clearly as we can see it right there. And so that does not mean marrow involvement, it means callus superimposed, bone callus superimposed, and so it's obliterating the image in comparison to its neighbor. So when we did that in comparison to the other view on the other foot, that is night and day. Clearly a stress fracture formation rather than hyperuricemia or gout or any other pathology. Unfortunately was not treated properly immediately and will require care. So that is basically it. Now from a foot standpoint, when we look at it on the non-symptomatic foot, as we can clearly see, the tendons, the veins, very clear. The color is very nice as well and consistent along the leg, ankle, and down to the toes. In comparison to this side, which is the symptomatic side, it's more pinkish, more hued. And so therefore there's something going on as well as the swelling. I cannot see the tendons and the veins as clear in comparison to the other foot. So her symptoms is along this area, and you can feel a bony protuberance, which is the callus formation that we saw on the x-ray. But more so, there's pain here, and then it claims travels that way. And that's the deep peroneal nerve that's being entrapped because of the buildup of bone across in the space, and needs to be addressed. Now, if all else fails with care, then a corticosteroid would be required into the area versus an MRI or decompression. Sometimes PRP seems to work very, very well as well in this situation, called platelet-rich plasma injections in comparison as well. So that's basically it, a stress fracture of the right foot, 8 weeks untreated. As you can clearly see, the foot is not the same in color versus girth and edema and swelling. Bye-bye.